Well, there are a few things that can ruin your family holiday gatherings, like talking politics, religion, and spreading sickness.
Yeah. Let me get away from you. Let me scoot over a little bit. We're too close. But it's the time of year when everyone is coming down with some sort of virus or stomach bug. So that's why we have New York City's acting health commissioner here to spread not germs, but give us some tips.
Yeah.
Dr. Michelle Morse, welcome to the show.
Thanks so much for having me.
Okay, so what are the biggest winter illnesses that we're concerned about right now?
This is the time of year where we get worried about lots of different viruses, and it's not just COVID. In fact, it's RSV, influenza, and many other types of viruses. Now, that is normal for this time of year. We expect the virus rates to go up when people stay inside more, when it's cold outside, and at the same time, it's very important that you protect yourself and your loved ones at this time of the year.
You sound way too excited talking about viruses. I was just going to say, you're like, this is a time.
It's because you can protect yourselves. That's why I'm excited.
You can prevent it. But speaking of those that you mentioned, RSV, COVID, the flu, where do we stand right now in New York City?
Absolutely. It's a very important question. What I want everyone to know is that we've seen an increase in flu rates of 90% over just the past week. That means we are on the upswing of the curve. Yeah. That means wherever you are right now, you are likely to be in contact with someone who might be sick and who might have a virus. Flu, COVID, RSV, or something else. So protect yourself. It's not too late to get your vaccines. Yeah. And it's not just COVID vaccines. It's COVID and flu. And if you're eligible, RSV. If you're sick, get tested immediately. You want to know which of those viruses it is and get your vaccine.
The holidays begin next week as we're going to be gathering with family and friends. Do you expect to see an even more increase when it comes to these illnesses?
That is exactly the right question.
Yeah.
Unfortunately, we have not yet hit our peak. So that means for the foreseeable future, the rates of all these viruses is likely to continue to go up. And at the same time, if you wear a mask when you're in crowded places, if you get your vaccine, wash your hands a lot, stay home and get tested if you're sick, those are the things that are going to protect not only you, but your whole entire family during this respiratory viral season.
I know I was making light of it a bit, but in some cases you have RSV that can end up turning into pneumonia for a number of people. Why is that, and how do you prevent that?
It's a really great question. This is exactly why we want folks to protect themselves. Some people have immune systems that can't quite fight the viruses as well. Others have underlying conditions that make it harder. And so you can't always tell who's going to get sicker from these viruses, like a pneumonia or some other complication, like being hospitalized or even worse. So that's why we tell everyone, get a vaccine. RSV if you're eligible. Just about everyone's eligible for flu and COVID, and those are the best ways to prevent complications, hospitalization, or even worse.
Okay, you mentioned it's not too late to get your vaccine.
That's right.
Let's talk about kids, though.
Yes.
I saw a kid down the street that had a horrible cough. I didn't know if it was the whooping cough or whatever it is. Are there any illnesses that are more, prevalent among kids around this time?
Oh my gosh. Well, the kids are out in the community in ways that other folks may not be. They're around each other. Yeah. There's daycare. All of these things really do lead to the spread of viruses. There are many other viruses. You are right in that whooping cough has made a little bit of a comeback. It is vaccine preventable.
Oh, okay.
So again, get your vaccines, and we encourage all children, especially children that are in daycare or in school, to get their vaccines to protect themselves, other kids, and their whole family.
What if you're against vaccines, which a large part of the population is? How do you prevent getting some of these things?
There are certainly people who, for either medical reasons or other reasons, are not comfortable with vaccines. The first thing I'll tell those folks is I understand that you have your opinion, and at the same time, we know that these vaccines are safe and that they actually work. They're effective.
But that's not going to change your mind. What do they do?
Other things to do. Wash your hands. Wearing masks, especially a tight-fitting mask in crowded places, subways, big events. And you can also certainly do things like stay at home. And if you're sick, get tested so you know what virus you have. Okay. Because sometimes you can get treated that will make you feel better. It'll make everyone around you feel better. And again, you won't be spreading your germs to the friends and family that you love so much.
And the little ones. I felt bad for the little kid. He was on one of those pedal bikes, and he was just coughing up a storm.
But you were like, keep on pedaling.
That's right.
Exactly. I was like, Dad, he need to be at home.
By the way, props to Props to our graphics department. I love the gingerbread with the mask.
That is the right message. That is the right message.
Thank you, Dr. Morse.
Thank you so much for having me.
You in studio.
Thank you.
And for more healthy tips, by the way, you can follow the health department on Instagram, NYC Healthy, or visit their website. Y'all do some dances on your Instagram?
Oh, absolutely.
Okay, great. Good to know. You see the info right there on the screen.